Well, January is Cervical Cancer Awareness Month, and every year in the U.S., about 13,000 women are diagnosed with this disease, and more than 4,000 women will die from it. Dr. Dana Bittner is here this morning to tell us more about this condition and how we could really keep an eye out for it. And it sounds like it's very easy to treat and preventable if it's caught early.
Yeah, I know. It's like I wish we didn't even have to talk about this because it's so preventable. And you know, if women are at risk for it, especially if they get screened and caught early, it doesn't have to be a big deal.
Yeah. Let's talk about the screening. I mean, women know you do this Pap test. It seems like the recommendations have changed over the years about how frequently to have this test done.
They have, and for good reason, because back in the day when I early trained and became an OBGYN, we did way too much to people. We did way too many procedures for fear of it progressing. And now we have a much better sense of for whom procedures are needed, right? So screening has changed, and we're also testing for HPV. So that's what's changed.
So what is the recommendation now for how often a woman should have a Pap test?
So when, first of all, first Pap should be at 21.
Okay.
And we don't test for HPV until 30. So usually it's a Pap smear every 3 to 5 years with HPV starting at 30, and then a woman could choose HPV testing or Pap smear. So basically every 3 to 5 years is that number to keep in your head.
Okay. And what can these tests detect? What can they tell us?
So these tests tell us, number one, are the cells abnormal? Are the cells inflamed, angry, I like to say? And if they're angry, why? If they're angry at all, then is there HPV present? We know that most cervical cancer is caused by HPV, human papillovirus. And so if HPV is present, then we need to investigate more.
And there are some simple procedures that could be done if there are some abnormal cells
there. There are, and so that's all about seeing, like looking with a little telescope and maybe taking a biopsy. And if that biopsy is positive, then deciding from there what to do next.
Okay, let's talk about how this all applies to Jane.
So Jane was 52 and had normal Pap smears, and all of a sudden had an abnormal Pap smear. And so she needed a colposcopy, she needed a biopsy, and turns out the HPV she had was low risk and the cells were not that angry, and we could watch her over time. And so it was such a relief for her, and she was like, if I hadn't gotten this Pap smear done, what might have happened?
Right.
And it might not have turned out well.
Sure. Well, it's so scary to think about. We've heard about this vaccine, mostly marketed, I feel like, targeted for younger girls. So now you're saying even older women should have this vaccine.
Yeah, so this HPV vaccine, it really does help reduce the risk of getting HPV, and HPV can cause cancer not only the cervix but elsewhere in the body, and so it's really important to know if you're at risk. Even if, let's say, potentially you're going to be newly sexually active at 50, you might want to consider getting the vaccine. So insurance might not pay for it, but we're recommending it at any age if you're at risk.
Okay, and quickly, the risk factors for cervical cancer would be?
Smoking cigarettes, having sexual activity early in life, having multiple partners, having pregnancy early, but that smoking cigarettes is a big risk.
Okay, we've got them all there on your screen. We'll get all this information and linked on our website as well. Dr. Bittner, we appreciate your time as always.
Thank you.
Thank you so much.